Hello, my name is Gabby Quinn, and today I will be explaining why I believe healthcare should be free in the United States. So let's put ourselves in a what if situation. So, what if you received a phone call regarding that one of your loved ones was in serious critical condition and didn't have the funds to support themselves and their medical expenses? That is not ideal to anyone. No one wants to go through that situation. People are going through the situation right now. And basically, this PowerPoint is just on why I think that this debate should be settled and why I think healthcare should be free in the United States. So, my first main point from the get go is that healthcare is a human right and everyone should have access to it regardless of their ability to pay. No one should get sick and worry about the ability to pay for their healthcare. You know what I'm saying? Like everyone is entitled to their own health and body and should not have to worry about whether or not they have the funds to receive care. So basically in this slide, I just put being alive is a privilege, which it is, and healthcare is a human right. I just think healthcare, everyone should receive it. It's deserved. And that brings me to my next point. So a universal healthcare system would help reduce healthcare costs by constituting a universal healthcare system. Costs will significantly go down in price. People are currently paying through insurance and out-of-pocket expenses, which can be really expensive. And a universal healthcare system will basically just help introduce Medicare, which will help negotiate prices overall. My next point is healthcare costs are significantly higher in the United States compared to other countries. And in this slide, I basically put a picture, like a breakdown of what people in the US are paying for healthcare compared to other countries. And as you can see, the US is the black line at the very top. And basically all of the other countries are kind of conjoined in the same area, around the same, 9 to like 11%. And you can tell from UK all the way to US, that's almost a 9% increase on what we're paying. And I just think it's insane. So I just don't understand why Americans are required to pay more for the same healthcare benefits that other countries are paying for, but for cheaper. So, for example, I'm going to be focusing on Denmark, which is this blue line right here. They're currently 11.1%, and US is 17.1%. So, for example, in Denmark, a hernia repair surgery is 1,754 Danish krone, which is equivalent to 258 US dollars. Whereas in the US, a hernia repair surgery is 7,750 US dollars, which is just a significant increase. That just goes back to why are we having to pay a significant increase of cost when we're basically receiving the same healthcare benefits. I just don't understand why it's way more expensive. So my next point is a universal healthcare system would help promote preventative care and early treatment, basically stating that by catching illnesses early on, this will result in cheaper treatment. I believe that because of the healthcare prices in the United States right now, them being so high, people are nervous about going in and getting the care that they need and deserve. And they're waiting too long, which is causing their illnesses to worsen, which is resulting in more expensive treatment. So by catching illnesses earlier, this will result in cheaper treatment. So my next point is a universal healthcare system would make the healthcare process easier and make people better understand their coverage and benefits. People would just understand healthcare prices more in general, and this would result in people having control over their healthcare and reduce costs. And then a universal healthcare system would also help result in promotion towards public health by supplying access to vaccinations and preventative illnesses So doing this overall would help decrease the escalation of diseases and improve overall health outcomes. By people knowing that public health is cheaper or free, it will help heighten overall health outcomes because, as I stated in my previous point, I think people are just nervous about, not necessarily nervous, but just don't want to pay the prices that are, required right now when they're ill. They're maybe waiting for their illness to go down, and like they just don't want to enter the hospital and have to pay, $17,000 like in medical expenses. It's just, I think it's absurd. So this is just another thing. These are statistics. So 72 Americans die each day, 500 Americans die every week, and 2,175,000 Americans die each month. And I'm not necessarily saying this is because healthcare is not free, but I think that, again, it goes back to people not wanting to pay the prices, thinking that they can, outdo their illness and wait it out and not worry about having to pay those prices. But it's, it's paying in population. People are dying. And I think that healthcare should just be free, like, to fix that. So while I think both arguments are valid, whether you think healthcare should be free or not, ultimately the decision of whether healthcare should be free in the United States is very complex, and it requires careful consideration and a variety of factors, including cost, quality of care, and access to care. I strongly believe it should be free, as stated in this PowerPoint, and that is my main argument. Thank you very much.